I've seen this paper before. As you said, it came in April. So from that time, I've been following this, and quite a few people have been asking about this. Now, basically, let's break down type 1 and type 2 diabetes so that people will know what these two conditions are. Type 1 diabetes is a condition which occurs in children, also can occur in adults, but predominantly in children, where suddenly the pancreas stops failing. Overnight it can happen, within a few days it can happen, and then thereafter lifelong insulin injections are needed. So if you don't give insulin, they'll die. So therefore, insulin is the only treatment for type 1 diabetes. You can give it through pens, you can give it through syringe, you can give it through pump, you can give it through whatever way you want, but you have to replace the insulin. Insulin is like oxygen to our body. If you don't have oxygen, you'll die. If you don't have water, you'll die. If you don't have food, you'll die. If you don't have insulin, you'll die. So you have to replace it, and they have zero insulin in their body. So they have to. Now, with all the methods of improvement which has come for type 1 diabetes, we still don't have a cure for type 1. So the methods of giving insulin has improved more and more and more and more. Today, the artificial pancreas pumps that we have are close to a cure, but it's still not a cure. They're still giving insulin. So now you have to replace the beta cells in that type 1 diabetes. So how do you replace it? You have to get it from a human being. Human being has only one pancreas. So we can't take all the beta cells out from one human being. So only from a dead body usually you can take. So when you take from a dead body, you won't be able to get all the beta cells needed to cure one patient. So you'll probably need to take from two people who have died recently, who are only brain dead probably, because the pancreas within 8 hours it gets completely atrophied. It's one of those first organs to get destroyed. So if somebody dies, immediately a surgeon, and it's not something like an eye where somebody can come, technician, take a bit eye and then transplant it. It's not like that. It's deep inside. So you need a surgeon to operate, remove the pancreas, remove the thing, then the cells have to be removed. It's a very costly, complicated process, but it's not new. People have been doing this for the last 30, 40 years, saying diabetes will be cured, diabetes will be cured, diabetes will be cured. But the problem is, where do you get the beta cells from? You don't have enough beta cells to get whichever islet transplant you do, pancreas transplant you do. So finally, they said from stem cells, we have to make new beta cells. So stem cells are progenitor cells. So the body first produces a stem cell, which can then become a liver cell, pancreas cell, heart cell, this muscle cell, whatever. And there are different growth factors, and we are close to bringing, in fact, heart and all that already with the heart attack and heart failure, they're already started doing stem cells. For some of the foot lesions which don't heal, they put stem cells and so on. The pancreas, it has not been so easy because in type 1 diabetes, there is an autoimmune mechanism going on whereby the beta cells get destroyed. That's why they get diabetes in the first place. Now you take somebody else's beta cells and then you put it, you make it stem cells and you make it into beta cells and then you put it into somebody's pancreas, the body will immediately destroy it. So to prevent it from being destroyed, you have to give immunosuppression. Now immunosuppression is like cancer therapy, chemotherapy. And how long you have to give it? Cancer you only give for 6 months. Here you have to give it lifelong. So is the treatment better or the disease better? If you ask, no, disease is better because you can just give insulin, which has been around for 100 years. People have lived with it. This kind of a thing is not easy because you have to give immunosuppression all your life. The moment you stop, they'll reject and they'll go back. Having said that, it's not been easy to for the stem cell. The real leaders in this are from Boston, Dr. Douglas Melton and his group. He was earlier at Harvard, and then now he has set up his own company. And they have been working in this for last, I would say, even 20 years. They've been working. They also claimed last year and the previous year and the previous year, they've claimed, like this Chinese thing, one patient cured, one patient cured. They've not done it in children. They've done it in adults only. And so it is coming, but we are not hearing that 100 people are cured or something. We are hearing of one case, two cases. That means it's still in its infancy, and it may come. This is how science always advances. Overnight, it doesn't advance. So there hope that yes, maybe a few years from now, 5 years from now, 10 years from now, we may have a complete cure for type 1 diabetes. But you are talking about type 2 diabetes. Type 2 diabetes is a completely different cup of tea, because type 2 diabetes is a common form of diabetes. When we say diabetes, we mean type 2 diabetes. It occurs in adults. It occurs not due to insulin deficiency, but mainly because of insulin resistance. There is some insulin deficiency, but they still have 50%, 60%, 70% of the insulin. So they don't really need insulin injection itself. The majority of them don't even need insulin. What you have to do is that insulin is not working, so they have insulin resistance. So what you do is you give drugs to make it work. The old drug was metformin. You give metformin, insulin will work better. It will reduce insulin resistance. Today we have got SGLT2 drugs, GLP1, DPP4, so many drugs are there which can make the insulin work better. There are some drugs which will also make the insulin secretion little better, because already it's there. You just have to make it little better. So the treatment for type 2 diabetes is diet, exercise, weight reduction, because normally they're overweight. You have weight reduction. That's why all the newer drugs which have become very popular, the weight reducing drugs. In my opinion, stem cell therapy for a type 2 diabetes is not even indicated, because you don't even need insulin. So why they went and did stem cell therapy in a 50 odd year old type 2 diabetic beats me. I don't know. That would not have been the approach which I would have used. First of all, unlike type 1 diabetes, even if you don't give insulin, they don't die. The sugar control may not be very good, but they don't die. So it's not an absolute indication for things. Also, we don't know whether without immunosuppression they have succeeded. So yes, I'm glad that China has taken the lead. In India, in fact, we have had in the PGI Chandigarh many years ago, in type 2 diabetes, they tried stem cell therapy, because in type 1, you need a lot of insulin secreting cell. So they said, at least in type 2, let us see whether it works, where you need a little bit of insulin. At least for that, let us try. And they did some 4 or 5 cases, and there was some partial success. But then later on, they didn't pursue it, because the problem with all this is scaling it up becomes a problem. For one patient, 2 patients, you can do. Want to give it to 1,000,000 patients, where do you have the stem cells to produce? In our own lab, we were working on stem cells a few years earlier. And one of my scientists actually created insulin producing cells in our lab. It's so beautiful to see sugar coming down. In animals, we're able to show that. Even in humans, we're able to show that. But when it came to scaling up, we needed big funding to do that. And we applied for 2, 3 funding, we didn't get it. So we gave it up. There have been others, like Dr. Ramesh Bonde has spent a lot of time doing stem cells in India. And of course, as I said, in type 2 diabetes, PGI Chandigarh, they have done. So there are people attempting it, but so far nothing near a cure. I don't know whether in China many more cases are being done, because till the success comes, they will not declare it. So I would say it is a good sign that we are beginning to see light at the end of the tunnel. So that way it's very good. But the application would be, in my opinion, more for type 1 diabetes than in type 2 diabetes. Globally, as I mentioned, the team which is the world leader in this is from Boston, from Harvard, and now I think they have a company which is also doing it. I know that in every conference I attend, American Diabetes Association, European Association, International Diabetes Federation, they have a stall. And then they say, we are doing this research. So we say, why don't you come to India? We use some of our, no, we are doing only in 5 people, 10 people, very limited. FDA has to approve. So it's under very strict quality control, it is being done. So there is research going on. There is active, what is not there 5 years ago, definitely is happening now. I would say, it's very difficult to guess or predict, but I would say in about 5 years, we may see something, not in the next 6 months, but maybe in the next 5 years, something positive may come. If they are able to do, already they're talking about without immunosuppression, how to do it. And then scaling it up, some big industry has to come and then start producing it. See, when insulin first came, insulin was produced from dogs first. Okay. Then then of course they started making it from pigs and from cow, ox, and all. First ox, then pig, then using synthetic DNA technology, they start genetic engineering. They produce human insulin, so you didn't need animals at all. And that is how human insulin came. Now we've got analogs of insulin. All that took about 20, 30 years for it to happen. In the case of stem cells, first you produce the beta cells, then you check the quality, then you have a mechanism to scale it up. And then even then we don't know whether it will be one injection or not. Because we give one injection, it may last for a few months or something. Later on, the cells may get destroyed, which means maybe every year you'll need an injection. And these injections are not simple IV injection. You have to inject it into the liver or something because the cells have to go and settle. It can't go in the blood like that. So you'll have to go and settle in the liver. So it's not that easy to do. It's not like just taking insulin injection, which you can yourself take. So it has to be. But having said that, there is hope. There's a lot of talk about it. We call it as islet cell replacement therapy. So there are a lot of people working on it. It needs tremendous amount of funding. In fact, billions of dollars are being spent on that. I don't think in India that much of research funding is available to do this. And I don't think, to my opinion, my knowledge, anybody is full-time working on stem cells. I know people are working on pumps and artificial pancreas and that kind of technology engineers are working on. But China can do it, why can't we do it? So I think we should also get a good program to look after, because we have the largest number of type 1 in the world, by the way. So we have almost 1 million cases of type 1, almost the first in the world we are. For some reason, China has lower. So second is US, third is Brazil, fourth is only China. For type 1, they have less. Type 2, they have lots. So I think the biggest thing which everybody is talking about is the GLP-1 drugs, because the GLP-1 agents, unlike insulin, is good for those who are having type 1 or no insulin in the body. But one of the side effects of insulin is two side effects. One is you'll gain weight. It's a hormone. You keep on injecting, you'll put on weight. Second is that you can get low sugar. If you take insulin and don't eat, you'll get low sugar. So these two are the major disadvantages, although it's life-saving, but these two are the disadvantages. The GLP-1s are actually almost like an opposite of insulin because they help you to lose weight rather than gain weight. And there's no low sugar at all. Okay? And they work in a completely different way. There are hormones in the gut, in the intestinal area, called GLP and GIP, glucagon-like peptide and gastric inhibitory peptide. So those hormones are stimulated and they help to produce insulin. Now, the big thing about these GLP-1s is that they can help you to lose weight. And unlike the earlier weight reducing tablets, which only 1 or 2 kilos you lose, here you can lose 10, 15, up to 20, 25 kilograms in weight, almost like a bariatric surgery. It's just a weekly injection. So they become a runaway success abroad. And now, just recently, 2 companies have introduced it in India and is already catching up in India. For those who have tried weight reduction by diet, exercise, and all that, you will know that it doesn't last. The moment you lose weight, you'll regain it. The moment you lose weight, you'll regain it. This has been going on like a seesaw yin-yang effect. It will be going on for years, and people get frustrated because the more they try, the more the body will correct it and bring your weight back. By using these GLPs, they're completely able to reduce weight and maintain the weight. The only thing is that they are expensive. And second is that they do produce some nausea and things like that. And third thing is they're only as effective as long as you take it. If you stop it, then slowly your weight will come back. But at least if you take it, it maintains. Suppose you lost 10 kilos, it will remain at 10 kilos, which is a big step forward. So mice are not humans, as we always say in any presentation. Whenever somebody comes and talks about mice and curing, the first comment will be mice are not humans, humans are not mice. See, the animal is so small, and the number of islet cells needed for curing, the number of beta cells needed, maybe a few thousand. is all is needed for a mouse. So to get that, and then they don't have much of autoimmunity and all the other things which humans have. We have emotional problem, we have this one problem, mind is controlled, so many other factors. Our eating pattern is different, everything is different. So, and our body weight is so different that from a small mice, suppose you inject 5,000 beta cells, that will be enough. It will produce a cure and that's it. So it's quite easy to produce that in rats. As you go higher and higher to dogs and primates, and it gets more difficult. And in the case of humans, so far these stray cases of cure we talk about, but otherwise a permanent cure for type 1 diabetes is still coming. So we don't have it. I'm not saying it'll never come, it may come, and we are all hoping it will come. At least one major disease which gets knocked off, it will be good. I don't see such a cure for type 2 diabetes coming, because type 2 diabetes is a lifestyle disorder. It is something which is passed on from parents, father, mother, genes are passed on, and then obesity is a driver of that. And obesity is continuously increasing in the world, except one or two countries in Europe. Everywhere else, obesity is sharply increasing. Obesity produces insulin resistance, and if you have the gene for getting diabetes, it will become diabetic. Of course, the good news is that if you reverse your obesity, reduce weight, you can reverse your diabetes also. But you put on weight, it will come back again. It's not a permanent cure. So therefore, the challenge is that we need to be on lifelong discipline, diet, exercise, weight reduction, reduce stress, do yoga, do pranayama, de-stress. All these things, if you do, you can have either a reversal of your diabetes, or at the very least, keep your sugars under control so that you don't develop complications of diabetes. Our treatment from last 50 years has been how to make a person with diabetes live a long and healthy life. We are not saying we'll get rid of all your medicines, we'll produce some magic wand which will produce your diabetes and take away your diabetes. We're not saying that. What we're saying is you come to us, we'll help you to have a long and healthy life. Many of my patients have crossed 100 and they're doing very well. 95 years now, I've got some 500, 600 cases now. So why do we bother if they have diabetes? They've lived their life, they have no complications, their brain is intact, their physical body is intact, they're able to walk about and do everything that they did, and they may be still taking medicine, but they live to tell the tale. And therefore, I don't worry about cure, remission, this thing, that kind of thing is, if it comes, it comes. That's for a very small percentage of people. The whole of type 1 diabetes is only 2% of the entire diabetes, only type 2. But that 2% is a very significant 2% because they have to take insulin 4 times a day. So if you have type 1 yourself, then it's 100% for you. There's no point saying, oh, you're only part of 2%. Don't worry about it. We can't say that. For you, it's we've got 1 million cases of type 1 in India. What about that 1 million cases? It's not a small number. It's not a rare disease. Therefore, for them, they're all looking forward to the cure. Even when the best pancreatic, artificial pancreas comes and they're able to keep the sugars absolutely under control, it's like an autopilot. You just fit the pancreas, and that too, it's not even it's a pump. You don't even put it inside your body, put it outside your body, and then you program it. It will keep your sugars like a straight line without going up or down, like a normal non-diabetic person. That means that's close to the cure. There's no immunosuppression, nothing else needed. It's pure insulin which is going in. So therefore, you can't beat a pump in the current day if we are able to give a pump to everyone with type 1 diabetes, as they are doing in the UK now. They've started giving every type 1 free pump. They said it's life-saving, so we have to give. It's about 6 lakhs. The cost of that pump is 6 lakhs. How do we give it to 1 million people? 1 million into 6 lakhs, that's a cost. Who's going to pay for that? And then there's a running cost of about 20,000 rupees per month. So for those who can afford, it's great. For those who can't afford, we approach charities and say, this particular child needs it, can you give? And on a case-to-case basis, we're able to give a few pumps free. But there's a limit to what we can do. It's 10, 20 pumps I can think of. I cannot think of 500 pumps, 1,000 pumps. Who's going to pay for it? So that's the problem. No, I think the message to people is don't worry about diabetes. Diabetes is a controllable disease. As I said, you can have a long and healthy life up to 100 years of age without any complications, but you have to look after yourself